A patient today asked about sleep hygiene and basically behavioral modifications that they can make to improve their sleep and improve their sleep routine without the use of medications. Pharmacological interventions for sleep, like anxiolytics, for example, have abuse potential. They can make your body physiologically dependent on them. You can build tolerance to those medications over time. And the truth is that if you're not utilizing proper sleep hygiene techniques, you really don't want to just jump to assume that you need medication for sleep. You want to work on your sleep in a more natural way first. So a couple of things to consider. One is keeping a really good and consistent routine. Often individuals will have a certain routine during the week, for example, and then a very different routine on weekends. And then it may take a couple of days into the week to adjust to their new work week routine, and it may take a night or two during the weekend to adjust to their weekend routine. So I recommend going to bed at about the same time and waking up at about the same time, regardless of what day of the week it is, whether it's a work day or not a work day. When going to bed, if you get into bed and you're having difficulty falling asleep, after 20 minutes or 30 minutes, you actually want to get out of bed. You want to sit, lie down in a different setting, maybe on a couch or on a chair or in a different room, still with the lights down low so there's not too much stimulation. You do not want to look at any screens, so you don't want to be scrolling through your phone or on Instagram or looking at a TV, but actually maybe reading something boring or doing something that may be calming to you, like reading a book or doing maybe a mindfulness relaxation technique, for example. But any screen time or being in a well-lit environment will wake you up. It will wake up those neurons in your central nervous system and it'll prevent you from falling back asleep. So get out of bed, do something boring for 20 or 30 minutes, and then when you start to feel tired again, then go back into bed. It's important that you associate your bed with sleep and with relaxing activities. So I tell people that the bed is really just for sleep and for sexual activity. It's not for sitting on your laptop, doing work, paying bills, or doing anything that you might find at all stressful or at all to be something that you may consider work of any kind. You want to make sure that you're avoiding substances that can prevent you from having a good night's sleep. And so a general recommendation is going to be to really limit alcohol, caffeine, and nicotine. And in particular, let's say for nicotine, if an individual smokes, I would say really don't smoke within 4 hours or 6 hours of going to bed. If an individual likes to have a drink or two, I would recommend not having more than a drink or two and not having drinks right before bed, because even if it may seem like alcohol makes you feel tired, it really disrupts your sleep architecture. And the same goes for nicotine, and the same goes for caffeine. I generally recommend no more than 1 cup of coffee per day, and having a smaller cup of coffee, especially now with Starbucks and other coffee places, really having coffee that's much higher in caffeine than some of your other coffees of the past. So maybe an 8-ounce cup of coffee in the morning, but definitely not having multiple coffees throughout the day, and absolutely not having a cup of coffee or any caffeine within 4 to 6 hours of going to bed. Now, if you have a difficult night of sleep, it's very important that you still wake up at the normal time that you would have woken up the next day, so that wake up at your same normal routine time that you're trying to keep 7 days a week. And during the day, even if you're feeling tired, make sure that you're not taking any naps. If you take a nap, then that's going to delay your ability to fall asleep, or it's going to decrease your ability to sleep well or for your normal amount of time the next night. And that can become a really vicious cycle. So even though it may be a little bit distressing or a little bit frustrating, if you have a difficult night of sleep, you want to wake up at your normal time, and then you really want to push through the day. And then when it comes time for you to fall asleep the next night, you're probably going to feel pretty exhausted, and you're probably going to fall asleep more easily, and you're probably going to sleep more soundly through the night. Some other recommendations: sometimes cooler environments or a drop in your body's temperature can actually be calming and can actually make someone more likely to fall asleep. So while I wouldn't recommend taking a bath right before bed, because that could potentially wake you up, if you take a warm or hot bath 1 to 2 hours before bed, then your body actually cooling down back down to a normal temperature or a little bit lower temperature coming out of that hot bath over the course of the next hour or two will likely make you feel a little bit more tired or sleepy. Obviously, you can use like a sleepy time tea. Some people recommend, or maybe in the past recommended, a little bit more warm milk, which has some tryptophan in it, which could be calming and could help someone to fall asleep. So these are just some basic general recommendations that I have. There are obviously some additional thoughts and If you believe this video pertains to you in any way, please be sure to reach out to a medical provider to discuss more and discuss an appointment.